Hi, I'm Lois Arata, and I'm going to do a skin, hair, nails, face, scalp, and head assessment on my patient James. So, I'll start with the skin. The skin is evenly toned and tan. It's smooth and firm. It's glowing. It's warm and dry. He has nice turgor. No edema, no cyanosis, no pallor, no erythema anywhere, no lesions. Very nice, normal, healthy skin. Okay, and then I will look at his nails. His nails are nicely groomed and clean. The nail beds are pink with instant capillary refill. The nails adhere nicely to the nail beds. The cuticles are flat. And then the nails look great. So I will move on to the patient's head. His head is normocephalic, nicely shaped. The frontal bone is here, the parietal bones are here, occipital's in the back here, temporal bones on the side, and it's symmetric and normally shaped. His hair is thick brown and shiny and clean. His scalp has no evidence of infestation. There's no flaking. There's no lesions. Healthy scalp. Any itching or pain anywhere?
No.
Okay. Let's see. And then we will test your trigeminal nerve, which controls your jaw movement. So if you would pretend like you're chewing. Good. And then clench your teeth. Good. And then move your jaw from side to side. Good. No crepitus or clicking from the TMJ joint. And so the trigeminal nerve motor function is intact. So we'll test the sensory function. So close your eyes, and when I touch you, say something. Say now.
No.
Okay, and that's the occipital maxillary.
No.
And the mandibular. Good. Okay, so your sensory function is intact. So both the motor and the sensory function of the trigeminal nerves are intact. So then we'll look at the cranial facial nerve number 7, which controls your facial expressions. So I want you to smile. Now frown. Okay, and then show your teeth. Good. And then raise your eyebrows. Puff out your cheeks. Purse your lips. Good. So all your facial nerve appears to be intact. So now we'll look at your neck. Your neck is symmetrical. Here's the trachea is here, and it's midline, and I can feel the tracheal rings. The thyroid gland is here. You can palpate it here. Okay. Good. Any soreness in your neck?
No.
Okay, good. And then, so we'll look at your spinal accessory nerve, that's number 11. So try to shrug your shoulders against them. I'm pressing down on your shoulders. Did it?
It's good.
Okay. Good. And then turn your head to the side. So that's your sternocleidomastoid muscle. And turn your head to the other side. Good. So your spinal accessory nerves appear to be intact. And I want to listen to your carotid arteries for any evidence of a bruit. Which is not present. That's good. And your thyroid gland. Yeah, no evidence of any bruits. That's good. And finally, I want to palpate your lymph nodes. So you have several groups. These are the supraclavicular nodes. And I don't want to be able to feel them because that would normally mean there's some type of infection or inflammation. So, Abby, no. So the supraclavicular nodes are non-palpable. And so, let's see. Here's the submental nodes. And there's nothing's there. There's no swelling or nodules. There's here are your submandibular nodes. There's no swelling or nodules there. Your cervical nodes are here. There's nothing that I can feel there. Good. Occipital nodes are in the back here, right under the occipital bone. There's nothing palpable there. No nodules, no swelling. And then there's the preauricular nodes and postauricular nodes. And you have no swelling or nodules on your lymph nodes, so that's great. So it's a normal assessment, and that's it for now.